In today's Medical Minutes, have you ever considered plastic surgery and just wondered whether or not you're a good candidate? I'm joined today by Dr. Sherman, and we're going to talk a little bit about that. And first of all, what are some of the things that you talk with your patients about, when they're trying to determine whether or not they're a good candidate?
Well, I think first and foremost, you have to be a good doctor and ask them, do they have any other medical conditions that would preempt them from having any procedures? Do they have any cardiac issues or anything like that? What medications are they taking? Patients that are on blood thinners are not as good candidates. Certainly smoking is something that definitely affects the result. If anybody's that's having any cosmetic or any other plastic surgery procedure, I ask them about their weight and has their weight been stable? And then also it's just a discussion about their expectations regarding the surgery and whether or not they're realistic about their goals.
Okay. So how can a person's skin type also play into their candidacy for plastic surgery?
Yeah, I think it's important. The patient's skin tone and their pigmentation can play a big role. The skin tone, patients have different skin quality depending on a variety of factors. They may not have as good elasticity, meaning it may not react as well, particularly in patients that smoke or patients that are exposed to the sun. For those reasons, we sometimes put patients on a skincare regimen. Darker skinned patients tend to have deeper scars. So these are all the things we kind of discuss with them before the surgery, just to make sure they're on base with kind of how their recovery is going to go.
That's interesting. I would never have had any clue that smoking would make your skin maybe less elastic than not smoking.
It affects things, definitely.
Interesting. Okay, so what about weight? Does that play a role in all of this?
Yeah, weight is important to, and I always tell patients, a lot of patients come thinking that plastic surgery can make them skinnier or help them lose weight. But it's actually the opposite. We like patients who have maximized all of their weight loss, either through diet or exercise. And I tell patients, get on a treadmill, do something. It doesn't have to be real strenuous activity, but just do something, 15 or 30 minutes every day, and that just gets their heart rate going, and it helps with maintaining their weight. So it's very important that patients maximize their weight loss.
Okay. All right. Well, Dr. Sherman, thank you so much for joining us today.
Thank you.
And we will be right back after the break.